Good morning. I am Dr. Maheshwari, fertility consultant from Oasis Fertility, Ananagar, Chennai. In this video, we just see about the stimulation process for IVF and about ICSI, fertilization and embryo development. First, the stimulation process for IVF starts from say day 2 of your cycle. So usually the stimulation process contains giving injections and monitoring the follicle growth. It's usually for 10 days. It can vary between 9 and 12. For some individuals, it can extend even up to 14 days. It depends on the growth of the follicle. So after the follicles attains a maturity size, then we give a injection for making it mature, and then there will be egg retrieval. Egg retrieval will be done after 35 hours, 35 to 36 hours after the final trigger injection. So the retrieval process will be done under a mild anesthesia and under transvaginal guidance. We do egg retrieval, and after the retrieval of the eggs, we do examine it under the microscope and we see about the number of eggs formed. And for the mature eggs, we go ahead with a process called ICSI. ICSI is the process where one sperm is injected into one mature egg. For example, if we get 10 mature eggs from your thing, then we inject 10 best sperms into the egg and we look for the fertilization. So on the day of pickup itself, the ICSI process will be over. So next day, we just check for the fertilization. So fertilization is the union of the oocyte as well as the sperm. So this is the sign of fertilization. Here you could see the two pronuclei. This is one from the oocyte and one from the sperm. So when we examine under the microscope two pronuclei, this is the sign of fertilization. So after this is on the day 1 of the cycle, and this we look for 16 to 18 hours after ICSI, we look for this. This is a sign of fertilization. And after this, we keep the embryo till for day 5 development. So this is on the day 2, it cleaved into this kind of cells. On day 3, we can see about the 6 to 8 uniformly cleaved cells, and this is on the day 3 developmental stage of the embryo. And on the day 4, there will be a compaction. These multiple cells unite and it compact, and this is said to be the morula stage embryo. And this is the day 5 embryo. This is said to be the blastocyst. And regarding the day 5 embryos, so here you could see a outer cell mass. This is said to be the outer troph ectoderm, and this is the inner cell mass. So this outer troph ectoderm should be cleaved, should be visible properly, and this is the inner cell mass. This is the future fetal development, and this is for the placental development. This is the day 5 blast. And maximum we can keep the embryo till day 6 for blast formation, and based on the number of embryos formed till day 6, we can go ahead with the freezing of the embryos. And in case of fresh transfer, we can plan on the fresh transfer on day 5 itself, or else we can freeze the embryos and we can go ahead with the transfer after the your endometrial preparation in future. Thank you so much.